Flu shots and other vaccines save lives.
But they can also come with a potential risk of debilitating pain that few people are aware of. CBS 2's Dr. Max Gomez here now to explain. Max.
And Maurice and Christine, we're talking about an unusual but significant complication. It comes not from what's in the shot itself, but rather injecting the vaccine into the wrong spot, into the shoulder joint or capsule. It can happen with any vaccine, but it's more common with flu shots because they're more often given by less experienced providers.
You could do this normally, but as far as over here, that's as far as I go.
Raul de Jesus has nerve damage in his arm. The pain is so debilitating he takes powerful painkillers.
Oxycodones, hydrocodone, and the list goes on.
I knew something was wrong because I couldn't really move my arm.
Debbie Russo needed surgery to fix the damage to her shoulder.
It was a lot of pain.
Both suffered serious shoulder injuries, not from an injury, but from their flu shot.
It can really be quite a significant problem.
According to infectious disease specialist Robert Duncan, this kind of injury is rare, but it can happen. It's usually because the shot is given too high in the arm.
It goes right into the joint space instead of into the muscle belly here.
Shoulder injuries really just started to become recognized recently.
Attorney Paul Brazil is talking about the federal government's Vaccine Injury Compensation Program, which recently added shoulder problems to their list of injuries eligible for cash damage awards. It's called SIRVA, or shoulder injury due to vaccine administration.
I thought he actually stuck it in my bone.
While any injectable vaccine can cause this damage, Brazil says most of his cases involve the flu shot.
In my personal experience, it seems that a lot of the vaccine petitioners get the vaccine at a pharmacy.
The Journal of the American Pharmacists Association published an article last year outlining the danger and giving pharmacists tips on proper procedure, including the ideal spot for an injection. Brazil says this kind of education is key.
I think it's a lack of awareness. I think that if people knew about SIRVA, if it was publicized more, then people administering vaccines might be more careful.
Again, this is a very rare complication and can happen with any vaccine. It's just that the flu shots are the most common arm vaccines for adults. Babies get most of their vaccines in the thigh or tush by experienced shot givers, pediatricians. This is not a reason to avoid vaccines. Maurice?
Okay, Dr. Max, thank you.